Hi, Mr. Jones. My name is Crystal, and I just wanted to talk with you a little bit about hypertension or high blood pressure. I noticed in your history that you have a high stress job, you have a history of smoking, you have a history of alcohol use and current alcohol use. Don't always pay attention to what you eat, leading to an unhealthy diet. You've had a recent, lately, a 20-pound weight gain, and then you've had some shortness of breath, especially with activity. And those are risk factors, and the shortness of breath could actually be a symptom of hypertension, high blood pressure. So I just want to talk with you a little bit today about high blood pressure. Basically, blood pressure in general is the force of blood pushing against your blood vessels as the heart pumps it out. Um, High blood pressure is when there is an increase in the force of blood pressure that it places on, or sorry, on the blood that it places the force it places on the vessels as it moves through the body. Um, there's a few different kinds of high blood pressure. You have primary hypertension, which used to be called essential hypertension. It is not caused by another medical condition. It is usually caused by your family history or any symptoms such as obesity, lack of exercise, poor diet, things like that, lifestyle. Um, Basically, over time, it can damage your blood vessels and cause brain aneurysms, dementia, heart attack, heart failure, kidney disease, even strokes and vision loss. So, usually people that have this, they're usually over the age of 65. They could be a diabetic. They could eat a high sodium diet, use alcohol, live a sedentary lifestyle, not get exercise, or even have sleep issues such as insomnia. Some of those symptoms are chest pain, shortness of breath, mental fog, nosebleeds, severe headaches, fatigue, blood in your urine, but also it can have no symptoms at all and it be discovered on well exams. Then there's another type of hypertension. It's secondary hypertension. It is caused by another underlying medical condition. Um, those conditions can affect your kidneys, heart, arteries, or your endocrine system, or even be caused by pregnancy. And those conditions lead to the high blood pressure. Often, with secondary hypertension, it is resistant to medications. It could require multiple medications or even be resistant to medications that once did control your blood pressure. Usually your blood pressure is very high. The top number is usually reading over 180 and the bottom number is reading over 120. It's usually an onset, like sudden onset. You're usually less than 30 or over 55, no family history, no history of obesity, even lived the perfect lifestyle, but still get this secondary hypertension because of an underlying medical issue that you already have. Those kind of present with the same complications also that can lead to artery damage, aneurysms, heart failure, weakened or narrowed blood vessels in your kidneys, trouble with memory. You can have metabolic syndrome, which is pretty much like increased triglycerides, low HDL cholesterol levels, high blood pressure, increased insulin levels. And then there's also another type of hypertension I wanted to tell you about, which is complicated hypertension. This actually shows clinical evidence of target organ damage, such as ischemic heart disease, a stroke, or chronic kidney disease. And the clinical evidence is usually based off of lab work or organ function tests. Um, the one I really want you to understand is the chronic kidney disease. So what happens with your blood pressure can weaken the blood vessels in your body due to the strong force, and that includes the blood vessels in your kidneys. Now, it's important to understand what your kidneys do. Your kidneys filter waste and extra water from your blood, and that is what creates the urine. So if you have high blood pressure, that constricts and narrows the blood vessels in your body, reducing the blood flow. And then once those blood vessels are damaged from that increased force, they no longer work properly. The blood vessels in your kidneys no longer work. They no longer filter the waste and extra water like they used to, which leads to chronic kidney disease. So it's important to try and reduce some of those risk factors that we talked about, that I pointed out that you have, such as the weight gain, the high stress job. You've already quit smoking, so that's great. And, alcohol use isn't great. And definitely get your shortness of breath and get that checked out.